Thank you, Conrad. And we're on the couch now. Thanks for joining us this morning. It is estimated that gout affects nearly 4% of adults in the United States. And if you are one of those affected, you may have noticed an increase in gout flare-ups in the summertime. And of course, here to tell us a little bit more about it is our expert nurse, Christina Perez. Thanks for joining us this morning.
Good morning. As always, glad to be here.
Hey, we're glad to have you bright and early and, learning a little bit of fun stuff here too as well. So what is gout and why is summertime worse for the flare-ups?
Yeah, so gout is a type of arthritis.
Okay.
It's made by uric acid or urates that are broken down by purines. Purines we take in what we eat, but purines, if you go back to A and P, is the foundation of our DNA, is one of the purines. So anyway, it's very abundant in our bodies. So when this uric acid breaks down, or the urate, breaks down, it's a weak acid and it causes deposits of these monosodium uric crystals. So if you think of crystals, they're probably kind of sharp and uncomfortable. And if you have that in a joint, it's not where you want it to be.
Yeah, it would feel quite uncomfortable.
Yes.
Right.
So how does someone know if their pain is due to gout or not?
Yeah, absolutely. So the biggest thing is you can check the synovial fluid, which is fluids in your joints, and see if there's buildup of uric acid. They can also do blood tests. The thing is, you can have uric acid buildup in your body for years before you develop any symptoms.
Right.
And so it's a lot of symptom based.
Yeah. So what would some of those symptoms look like?
Yeah. So the symptoms, you're going to have intense pain. So people will say, I just woke up this morning and my toe hurts really bad. Even to have like sheets touch your foot or your joint can make it that way. Wow. It's not always in the toe, but that's one of the main areas for it. It's going to be red. It's going to be stiff and just really, really uncomfortable. So that's kind of the telltale. It came on quick. It hurts really bad. It's super sensitive. And then they'll do the testing as well.
So we're, of course, trying to avoid something like this. How can we prevent it? Maybe gym? What are you thinking? Some cardio?
That won't actually help with this necessarily. Although healthy lifestyles are always good. Yeah. One of the reasons it's so prevalent in the summer is some of the risk factors are things like obesity, dehydration, alcohol intake of sugary drinks. So what are we doing? We're out on the boat. We're drinking alcohol. We're eating red meat and high sugary sodas, things like that. And so dehydration, because we're not drinking enough water, or we're out in the heat, like you said, is coming up this coming weekend. So those kind of things are what increase your gout flare-ups. And
well, that is certainly good to know, especially because you hear about gout and you kind of just think of it as an interesting word to say sometimes.
Yeah.
But it is a real thing and it affects a lot of people. Like
It does. And there are medications you can take. So for people who have these chronic flare-ups, so you're having them a lot more frequently, they're going to give you something like allopurinol to take long-term. But for short-term gout flare-ups, they're going to give you something like colchicine, which is a type of, like an NSAID, similar to ibuprofen, and maybe a steroid like prednisone to kind of bring down that inflammation that can occur in there.
And those things will definitely help people out?
Right. They help with the prednisone and the colchicine are good for short term, and then you are put on something like allopurinol for more long-term treatments.
Okay, so is there any other type of treatments, or is that kind of the only go-tos?
So you can watch what foods you take in, like red meat, shellfish, alcohol, things like that. You make sure you're staying well hydrated in the summer, reducing sugary drinks, which is always good even for like diabetes.
There's a lot of extra added benefits, especially to a lot of these things, when you're trying to have a well-balanced diet, avoid the extra sugars and, keep it active as you go.
Yes, because stress can affect it too. So
yes.
by working out and getting active can decrease your stress levels, which could improve it.
Do you know if we are having higher numbers of gout, or are we kind of seeing the trend going lower?
So in the summer, we're going to see more because
More of that, okay.
because of the dehydration,
sense.
because of
Well,
the
yeah,
eating, the
people are out in
grilling
the,
out,
on the boat, the water.
sweets. Yeah.
Exactly.
Exactly. The 80s plus degree
Yeah.
weather out
Oh,
on the
yes.
boat, you know, getting the little bit of suntan out there, and probably not drinking as much water as we should be.
Yeah.
Yes, and especially after the hottest June on record, you know, it's just going to get worse and worse. So.
Yeah, and then stress levels. You know,
Yes.
we're trying to get the boat out quick. We've got all the kids. We're trying to gather
yeah.
the gear. You know, so you do get worked up, and it's more prevalent in males, 30 years, starting around age 30 on up. Women, not as prevalent. If they do get it, it's typically postmenopausal.
That's very good to know. You know, so it's definitely affecting them at different times, interestingly
Yes,
enough.
right, exactly.
Well, thanks for telling us all about that
Yeah.
this morning. I really appreciate you, you know, giving us the gout info.
Great information here, I know.
You bet.
Well, coming up, we have what's trending, including a recent announcement from Hollywood megastar Margot Robbie that is nothing